For some of the syndromes that we talk about, we're very clear about what that means, and it's very, very difficult, and there's no easy way of talking through some of the conditions where may result in the baby dying during the pregnancy or shortly after the pregnancy. But we must give a very honest answer to what that clinical picture means. And in that time, we also talk to couples about what are their values and beliefs, what are their support systems like. So we spend a lot of time, who will bring you to this appointment, who are your supports, who's looked after your children today, are your parents close by, did you sleep last night, are you eating, how are you going to get through the next few days. So we talk a lot about coping mechanisms and who their supports are, and trying to advise them to do as little as possible, and call in their supports to get them through such a difficult time. While every case is unique, there are sort of set processes that we follow for a woman or for a couple. So many women will be referred to us who are distressed, in crisis, whether that be from an increased risk result or from a finding from an ultrasound. So the first point is to make sure they're in a safe environment, to make sure we attend to their basic needs at that stage, to make contact with a family friend if they're by themselves or their partner, just to spend some time with them, and that would be in this counselling room. And then depending on how much information they can handle, we will go through and talk to them about the findings on ultrasound or the screening result, take them through that. I generally say to a couple, are there burning questions you want to ask me first? So I let the couple set the agenda, and then based on how much information they can manage, we'll give them a little or a lot of information, and I make that assessment from how they're presenting and from what questions they're asking of me. So I will see them, we will go through that information, I'll talk to them about further testing options, and I will give them my contact details. So many women, when they're faced with an abnormality or a concern, who are in a distressed situation, can't take all of that information on that day. So it's really important that following day that they receive a phone call and have follow-up. Our role also is a coordination role here. So they will need to see one of our perinatal obstetricians, they may need to see a paediatrician, they may need to see a paediatric cardiologist. So depending on what the findings are on ultrasound, we will link them in and organise, we will coordinate or case manage their pregnancy to ensure that they're seeing all the right professionals in a timely manner. Another part of our role here is that we make contact with the referring doctor, whether that be the GP or an obstetrician at another hospital. So they're in the loop as well as to, we've seen your patient, this is what we've organised, and all of our patients and referring doctors will get a letter as well, just going through what we've discussed and what testing or what their options have been with regard to their pregnancy. For some couples who perhaps need more support, more time, we will link them into pastoral care, we'll link them into social work. We also have a group of specialist psychologists in the community who manage with high risk vulnerable pregnancies and pregnancy loss, so we may even link them into one of our local psychologists as well, so just to make sure they're supported throughout the rest of the pregnancy. When we provide information to couples, it really is quite an empowering experience. So couples at first, they're in a situation that they've never been in before, it's all new information. Majority of our patients do not have a medical background, so they're in very unfamiliar territory. So providing them information in layman's terms really assists, can be very helpful with their coping mechanisms, and can empower them and give them back some of the control by providing them with accurate medical information in a supportive environment.